Hey everyone, welcome back to Ionized Ideas. Today's video is all about radiologic technologist review, focused on patient care. Get ready to boost your knowledge and sharpen the skills you need in real clinical practice. Let's begin. Which type of blood vessel is most appropriate for taking a pulse? A. Superficial arteries, B. Deep arteries, C. Superficial veins, D. Deep veins. Which diseases require contact precautions? 1. MRSA 2, C. diff 3, TB, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. What is the very first action in performing a radiographic exam? A. Obtain clinical history, B. Provide appropriate patient assistance, C. Verify patient identity, D. Use appropriate infection control. Which medication is used to treat cardiac dysrhythmias? A. Epinephrine, B. Lidocaine, C. Nitroglycerin, D. Verapamil. Which of the following are examples of infection portals of entry? 1. Skin breaks, 2. Nasal mucosa, 3. Urinary tract, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. Contrast injection for imaging the spinal canal uses which parenteral route? A. Subcutaneous, B. Intravenous, C. Intramuscular, D. Intrathecal. How can a radiographer help reduce a patient's anxiety? 1. Explain carefully. 2. Avoid complex terms. 3. Listen attentively. A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. Which infections can be spread through contaminated blood? 1. HBV, 2. AIDS, 3. TB, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. What device is used to correct ineffective cardiac rhythm? A. Defibrillator, B. Cardiac monitor, C. Crash cart, D. Resuscitation bag. A small container that holds multiple doses of medication is called what? A. An ampule, B. A vial, C. A bolus, D. A carafe. Upon finding an unresponsive person not breathing, what should you do first? A. Begin mouth-to-mouth rescue breathing, giving 2 full breaths. B. Proceed with the Heimlich maneuver. C. Begin with 30 external chest compressions at a rate of 100 compressions per minute. D. Begin with 5 external chest compressions at a rate of 50 compressions per minute. In IV contrast classification, what does the number of particles per kilogram of water describe? A. Osmolality, B. Toxicity, C. Viscosity, D. Miscibility. A patient who is warm and flushed is described as what? A. Diaphoretic, B. Febrile, C. Cyanotic, D. Anxious. What can lead to cross-cultural misunderstandings? 1. Direct eye contact. 2. Certain gestures. 3. Standing too close, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. What does the legal doctrine res ipsa loquitur mean? A. A matter settled by precedent, B. A thing or matter settled by justice, c. The thing speaks for itself, d. Let the master answer. Which medical supplies may contain latex? 1. Airways. 2. Enema tips. 3. Catheters. A. 1 only, b. 1 and 2 only, c. 2 and 3 only, d. 1, 2, and 3. What information is normally included in a hospital imaging request? 1. Patient name, ID. 2. Mode of transport. 3. Referring physician, A. 1 only, b. 1 and 2 only, c. 2 and 3 only, d. 1, 2, and 3. Giving a large volume of IV medication slowly over time is referred to as what? A. An IV push, b. An infusion, c. A bolus, d. A hypodermic. Which document or person authorizes healthcare decisions when the patient cannot? 1. Advance Directive. 2. Living Will. 3. Healthcare Proxy, A. 1 only, b. 1 and 2 only, c. 2 and 3 only, d. 1, 2, and 3. An object contaminated with infectious microorganisms is called what? A. Vector, b. Fomite, c. Host, d. Reservoir. During which infection stage do microbes start multiplying? A. Latent period, b. Incubation period, c. Disease phase, d. Convalescent phase. What are signs of a partially blocked airway? 1. Dysphagia. 2. Noisy breathing. 3. Cyanosis, A. 1 only, b. 1 and 2 only, c. 2 and 3 only, d. 1, 2, and 3. All of the following about hand hygiene are correct except which? A. Artificial nails harbor microorganisms, b. Fingernails should be kept short, c. Hand lotion is required for good skin care, d. Hand washing is the best method of reducing the spread of infection. All are proper body mechanics except which? A. Bend the knees and keep the back straight, b. Keep the load close to the body, c. The back should be kept straight. Avoid twisting, d. When carrying a heavy object, hold it away from the body. When a patient has a Foley catheter, where should the drainage bag be placed? A. Place the drainage bag above the level of the bladder, b. Place the drainage bag at the same level as the bladder, c. Place the drainage bag below the level of the bladder, d. Clamp the Foley catheter. When assisting a patient with a strong and weak side onto the table, which side goes closest? A. Start with the weaker side closer to the table, b. Start with the stronger side closer to the table, c. Always use a two-person lift, d. Lift the patient carefully onto the table. Possible IV iodinated contrast side effects include the following except which? A. 1 only, b. 3 only, c. 2 and 3 only, d. 1, 2, and 3. In a BP of 145/75, what does 75 represent? A. 1 only, b. 2 only, c. 1 and 3 only, d. 2 and 3 only. Faxing health information is allowed under which circumstances? A. 1 only, b. 2 only, c. 2 and 3 only, d. 1, 2, and 3. Which are forms of intentional misconduct? 1. Slander. 2. Invasion of privacy. 3. Negligence. A. 1 only, B. 2 only, C. 1 and 2 only, D. 1, 2, and 3. How should a wheelchair be positioned when transferring a patient onto the X-ray table? A. The wheelchair should be parallel with the X-ray table. B. The wheelchair should be 45 degrees to the X-ray table. C. The wheelchair should directly face the X-ray table. D. The wheelchair footrests should be folded down for foot support during transfer. What did Dr. Kubler-Ross identify as the first stage of grief? A. Denial. B. Anger. C. Bargaining. D. Depression. When caring for an unconscious accident patient, which actions are appropriate? 1. Use name. 2. Speak normally. 3. Offer reassurance. A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. A cathartic is used for what purpose? A. Inhibit coughing. B. Promote elimination of urine. C. Stimulate defecation. D. Induce vomiting. What is another term for a nosocomial infection? A. Iatrogenic. B. Healthcare-associated infections. C. Droplet. D. Airborne. What needle angle is typically used for IV injections? A. 90 degrees. B. 75 degrees. C. 45 degrees. D. 15 degrees. What term describes believing one's own culture is superior to others? A. Ethnology. B. Ethnobiology. C. Ethnocentrism. D. Ethnography. Which are potential HIPAA violations? 1. FI accessible only to staff. 2. Authorization copy on file. 3. Encrypted computer files. A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. What can be done to reduce contrast medium viscosity? A. Warming. B. Refrigeration. C. Storage at normal room temperature. D. Storage in a cool, dry place. Shock caused by MI or pulmonary embolism is what type? A. Neurogenic. B. Cardiogenic. C. Hypovolemic. D. Septic.